All right, good morning. This is Chad Bursey. I'm the chair for pediatrics here at RUHS. I'm glad that you've joined us this morning. If you've tuned in currently or if you're watching this later, thank you for tuning in. So to cover our regional stats this morning, as of this morning, we've tested 86,000 patients, 6,053 were confirmed positive, which comes out to about a 6 to 7% positivity rate. It's down, which is good. We currently have 195 hospitalized patients and 68 in the ICU. Both of those have come down slightly. The hospitalized has come down a fair amount. The ICU patients has come down a little bit. The deaths are 270 so far. This is all for Riverside County. For San Bernardino County, they have 3,700 confirmed cases. They have a doubling time of 14.1 days. So a little bit, they're doubling a little bit faster than we are in Riverside County. They have 157 deaths so far, and they have performed about 41,000 tests with about 9% that are positive. So that's the regional stats. This morning, we're lucky to have with us Christine Ramsey from our communications team, and she's going to talk about the importance and value of good communication during a crisis situation. I think all of us have realized that, although she's probably going to share it more in depth on how we can effectively do that. I think one of the challenges has been the misinformation that's gotten out there in the public and even among healthcare providers. So thank you for joining us, Christine, and being willing to present on this topic.
Great, thanks for having me. Here, I'm going to share my screen. So I think communication has been a really hot topic, especially with COVID-19. I think we've realized, things evolved really quickly, and sometimes, especially early on, information was sometimes changing by the minute. So we wanted just to kind of go over some key principles for communication, and then also I'll share some examples that we've done at RUHS Medical Center. So just a quick overview. So, information needs to evolve during a crisis. We need to communicate clearly, simply, and frequently. I think trust is, never more important than right now as we try to re-engage with our stakeholders. Also, the concept of reassurance, especially with our teams or those that are and our partners that are closest to us, and then establishing a clear vision for. Sorry, I'm having trouble advancing my slide here. Let me.
You want me to try to share it?
Okay. Oh, sorry.
You got it.
Coming through? Okay. Sorry, it must have glitched for a minute. So kind of coming back to the information needs to evolve. So this is something from McKinsey and Company that I found. It basically talks through a lifestyle of a crisis communication and illustrates kind of the different areas as the crisis evolves, kind of the feelings that are maybe being expressed, and then kind of what the needs are for the communication as a result. So with that, you see kind of at first, when the crisis first happens, a lot of people are either confused or anxious. So a lot of times the best way to communicate is through facts and with clear instruction. And I think we saw that really early on as things were evolving with COVID-19. I think now, we're more maybe in the resilience or kind of returning stage. And so, I think we've kind of worked through some of the uneasiness, people feeling a little bit worn down. So we are kind of really working on positive stories and chances to connect. And I'll show some examples of that in a little bit later in the presentation of how we at Riverside University Health System worked on that. And then as we're kind of getting ready to transition into kind of this new normal, trying to get our employees and other stakeholders ready for that change, we're adopting this Keeping You Safe type of campaign that we're getting ready, that we've been rolling out in our physical buildings, and so show some examples of that in a minute as well. But with that, I think too, also just working to communicate clearly, simply, and frequently. So with that, usually you have a trusted small group that meets regularly. So within the Hospital Incident Command Center, it provides a great system for this, platform for it. And so, working closely with the commander and those chiefs in the PIC system at the hospital was great early on, especially to get the information and communicate that out regularly. I think you want to look at organizing, a source of truth. So, you have a main source of information coming to employees, especially in maybe the community, but that you're establishing those regular and frequent intervals of communication. Also, being transparent, so being honest and upfront. Maybe we, didn't have all the answers initially, and and as information changed, we early on went from saying, that because there wasn't a community spread yet, that a mask wasn't needed, and now, then there was a transition to, we should be covering our face. So there was a lot of just being transparent about why, and the need for that change. And then also to be kind of short and clear with the communication as well. The next area I wanted to kind of look at is the trust factor. So with the COVID-19, really looking at prioritizing safety for our stakeholders, for everybody involved, and just looking at, so whether it's PPE for the staff, how we're keeping our patients safe as they come in, looking at the visitor restrictions. There was just a lot of different phases that we went through as we kind of weaved our way through initially, and then kind of as we're coming back to what the new normal will look like. And safety just becomes a top priority in communicating. The second bullet point here is what you do matters as much as what you say, in building trust. So that's just essentially as making sure that our those that are associated with the organization are kind of walking the talk. So if we say, that we are, that everyone should be masking, that make sure that our staff are masking, and that we're masking to and from, our cars in the parking lot, and making sure that we're being maintaining social distance, and that sort of thing when we're able to. So I think when people see us, that building that trust is making sure that we're demonstrating what we say, what's important. And then also involving stakeholders. So some of this involves also a feedback loop with the staff and other community members that you're engaging. So looking to involve them maybe through a feedback loop, or getting comments and information from them, and then incorporating some of that feedback into what you're doing. The next area here is a reassurance. So I put here at the top, celebrate the positives. So during this critical period in which we're in, it's important to instill resilience in the people that we're communicating to, and that we're tapping into the sources of hope, trust, and optimism to kind of basically keep momentum building with our staff and with those that we serve, because we kind of lead the way in the safety measures that we're doing, and just making sure that we're being positive, even though there's a lot of things that may not may get us down or wear us down. So we try to remain optimistic in the situation. Also, people are always looking for ways to contribute. So I think getting employees involved in what's going on and how we're communicating as we move forward is important. It provides them a sense of belonging in the organization, and then also, make sure that they're feeling connected. So part of that too is, I think employees especially see maybe their identity grounded in a sense of support for others. So getting them involved is key. And then lastly, a principle is to look at establishing a clear vision forward. So I think it's a good time for organizations as we kind of move into the new normal to look back and connect to the organization mission as we begin to move forward. And I think now more than ever, it's really important to remind our stakeholders about who we are as an organization, what our mission is, to serve the community, and why that's so important. And then also around that to foster dialogue, again, with our stakeholders, so that we have a listening ear, and then not only with our employees, but also with those that we serve. And I have a quote here. It was from a surgeon-in-chief for a New York hospital. He basically, he was closing a memo, and he said that he reminded the staff that patients survive because we don't give up. And so I think it's important to shape a story of meaning for the organization, and also creating space where others can do the same for themselves and kind of come along with us as an organization. So part of that is, listening, and kind of maybe some possible questions could be is, has there been any unexpected positive outcomes for you during this crisis? So things that we can kind of be asking our employees or those on our teams, and what changes have been made that you would like to keep once this crisis is ended. And I think there's been a lot of lessons learned out of this, and I think one thing that may continue is the telehealth visits. And so there's been a lot of good things that have happened as we've gone through this. The next few minutes, I just want to take and just show you some examples of things that we've done at Riverside University Health System Medical Center. So I've put it into 4 different buckets. So internal communications, external communications, media relations, and social media. So this is just some visuals of things that we've done. So early on, we were communicating pretty much daily, sometimes twice a day with staff, with our updates via email. And we had a cadence where employees would expect daily communication with updates from the command center. We also we have an intranet site where we put up guidance and protocols that have evolved. And I think that's coming back to that single source of truth with communication, making sure, because things were evolving quickly, and just making sure that as things became outdated, to put the new items up and communicate that out. So our intranet site became a single source of truth. And I know on the physician side too, there was the app that the physicians were using. And so again, it's just another way to communicate out and have that single source of truth. I also have a picture here, some of our staff in PPE, just kind of just as a reminder that one of the things that we started communicating about is our PPE and kind of where we were at using a stoplight kind of legend. So the staff were aware where we were at with our PPE supplies. And I think that's important just to kind of be, let folks know. And I know that our team worked day and night on materials management side to procure what we needed for everybody to be safe and have the equipment that they needed to come to work every day. Also, looking at internal communications, we produced a video from our leadership out to our staff, and we're working on more as well. So we have that emailed out from our leadership. And then also working, we created a what we call Bedside Heroes campaign. So this is just kind of celebrating our team and the different aspects of just instilling kind of that mission-driven aspect into what they do. So you'll see here there's 4 different variations of it all around the hashtag Bedside Heroes that we were using. So the first one says Warriors for Health Unite. And then the second one in green says inspired by our frontline champions. The blue one, it says love is our superpower. And then the last one is defenders of hope. So we've created posters and put those up into our, around the hospital. Additionally, for external communications, we were working with our public health partners and then also hosting press conferences at the hospital, the medical center. We also created a preparation video to kind of let the community know what we were doing as we prepared. And there was movement on the campus, setting up tents, setting up maybe separate pathways for patients to come in, to let them know what to expect when they arrived on campus. And then talking a little bit too about our telehealth capabilities. We also set up a landing page website for COVID-19 for medical center and hospital-based clinics and our CHCs, community health centers, to access that had pertinent information. In the bottom left-hand corner, you'll see it says wait here. It's a queuing dot that we're launching and getting ready to put all of our social distancing and keeping you safe campaign out into our physical spaces. On the media relations side, we really wanted to look at celebrating our staff and our frontline heroes. And so we were able to kind of garner some media relations in regards to that. So there's some examples here. So there was a gratitude parade that was done on our campus, as many other hospitals have had. We had about 6 different media outlets for the flyovers that happened last week on Thursday with the March Air Reserve Base. So we got some media out of that. Also, there's a headline at the top that talks about a mask donation that was given to us. So we were also trying to incorporate communication around that. There's a couple other media relation items here that we had a couple weeks ago where there was a story focused on one of our nurses that has been integral in our testing and at our skilled nursing outreach. So there was basically a profile done on her and how she's helping the community with slow the spread of coronavirus. And kind of highlighting her and our team. And then we also had a success story on Mother's Day with one of our patients that recovered. And we also, as many other hospitals have done, did a video of her coming out of the unit, and we received pickup on other media outlets as well for that video on our social. Moving into social, so we've been reposting a lot of what public health is putting out. And then we've also been working on our Bedside Heroes campaign and other items that come up, especially we've had a lot of activity related to Hospital Week and Nurses Week over the last couple of weeks. And then the last thing I just put in here, there's a resource that goes to the American Hospital Association. They have a whole COVID-19 communications resource page. So if anybody's interested in learning a little bit more on what's available, it's a great resource and a lot of different links out to information that would be helpful for your organization. So with that,
Thank you, Christine. That's excellent. It's been really impressive to me how your team has managed the situation and really kind of come up with creative ways to communicate across our organization and across the county. Obviously, even this webinar is an example of that. I wanted to ask you a couple of questions. you spoke at the beginning about the the value of frequent communication, and that obviously things were changing quite rapidly at the beginning, and there was a lot of uncertainty even about the facts, and so I just wanted to see kind of how did your team handle that uncertainty, and that things were changing so rapidly. How did you think about that in the approach to communication?
Yeah, so I think, we were in from, as everyone knows, our organization was from the very beginning, with the repatriation flight. We were pretty involved early on. And even with that, we really were looking at kind of CDPH guidelines for, travel, like the screenings that were going on initially. That I remember that being some of the first communication that we put together, is helping to make sure that those that are coming into our facilities were being kind of notified, to maybe not come in, or, look at, if they needed a mask or something, if they've been traveling or had fever, cough, just some of those viral things. So early on, we were really looking at some of the sources of truth for public health, so CDPH, our own public health, the CDC guidelines, just kind of staying close to and connected with what was coming out in that regard, and really kind of sticking to those guidelines. And I know that those changed, so that it became kind of, I think, a little difficult, but just kind of continue to maintain frequent communication. And then when new changes came out, to make sure that we were communicating those clearly. I think too, we have a great leadership team, and I feel like, each of the commanders in the command center were great. And just working with them, they had a good pulse on what was happening inside the organization, and just a lot of it was a group effort and leaning in on their area of expertise, and just kind of working together to craft communication for staff.
Yeah, no, I agree with you. I as I said, I've been impressed with how your team has done this. And I'm sure there was a lot of decision making about, what kind of uncertainty to share, and then because you do want to be transparent, but then not confuse people. And so that creates creates some difficulties with communication. So then the other thing I wanted, you touched on this a little bit, but creative mechanisms for communication, and I think within our hospital, you highlighted some of those things. Social media obviously is one thing that organizations are finding ways to communicate. But I'm curious if you have any other kind of thoughts. I think that the county has done what is possible at this point as far as and I don't mean by the county, I don't mean just the medical center, but the county as a whole, of having data and things accessible on their website, and doing some of these news conferences and things like that. But it still seems like there has been a lot of dissemination of erroneous material and stuff like that it's really hard to counteract if you're just using accessibility as a thing. And so I'm just curious if you have any kind of thoughts on creative mechanisms for communication of facts and things like that might extend beyond that.
Some things that come to mind, I think one thing is that when you kind of look at communications, we have built into the hospital, our employees are kind of our best ambassadors. So I think kind of looking at them as, if we're communicating out to them within their spheres of influence, hopefully they're sharing out that information as well, to help with the, kind of control some of that misinformation that may be going out. I know one of the things that we've been looking at is, that's unique about a hospital situation compared to maybe some other types of work environments, is that a lot of our staff are deskless. I call them deskless staff. Like they're not checking their email frequently, maybe the nurses, especially, or there may be certain types of employees that maybe don't check their email as often maybe as other people that are maybe sitting more in a desk environment that have a chance to kind of be connected to their computer more frequently. A lot of our staff are taking care of patients. So with kind of looking at maybe some other, we've been investigating basically like an employee app that we can basically roll out in the future that would help with maybe providing communication directly to staff, maybe where they, everyone walks around with a, phone usually in their pocket. And so I think that is a way that maybe creatively in the future that we can work to maybe bridge that gap. It's definitely an opportunity. And I know that there's other hospitals, I think, that have already implemented those types of applications.
Yeah.
That kind of comes to mind. I mean, but I think, social media is definitely a good, if you can kind of establish a following and know, a source of truth that coming back to either public health or things that we're sharing out on our social sites. I think that's helpful for people to kind of be grounded in rather than maybe misinformation that's coming out from other circles that they're maybe following.
Right. I agree with you that their employees are, our best ambassadors for sharing information, especially those that are working, at the front lines of this. I think it would have, this really didn't make it into the media per se, not that we wanted it to, but that, our ICU capacity was nearly over, capacity. So if there had been much more of a surge, if our doubling time had continued at the rate that it had been across the county, we would have seen our county be overwhelmed with cases, and that would have been, really, really tragic. Fortunately, because of the measures that and the communication that your team has assisted with, that didn't happen. But people that were, that work in those units and are able to see kind of what's happening, obviously they have to be very conscious about, not sharing patient information and things like that. But saying this is reality, and then pointing back to the sources, like you said, of public health and that kind of thing is very valuable. And then I like this idea of celebrating the positives, the positive stories, and you mentioned a couple of those. And so I'm curious, are you looking for more of those? How would people go about contacting your team if they thought of a really unique story or something like that?
Yeah, thanks for that segue, because I think one of the things we're really working towards is, I think some of the volume, especially in the ED, has dropped off, but I recognize it's coming back a little bit, maybe slowly, but I think part of it is we've been trying to work on getting this message out, like, don't delay. Like, if you have if someone feels like they're having a heart attack or stroke, and it's stroke month, so we've been kind of putting some stuff out on our social media related to that, but don't delay, come in for care. And so right now I'm to help illustrate that, we're always looking for maybe patients, especially whether it's a COVID patient, but right now I'm kind of looking for a patient story around maybe somebody that's come in for a heart attack or stroke and they didn't delay, and they were, basically so grateful that they came in. Maybe they were fearful at first, but when they experienced, all the safety measures that we have in place, they realized, that that they're better off to come in than, maybe stay at home. And so anybody that has story ideas can always contact us at marketing@ruhealth.org. Again, it's marketing@ruhealth.org.
Okay. Excellent. Well, thank you so much for sharing with us, Christine. I've been so impressed by what your team has done and the organization as a whole. It's just handled this, incredibly well given the circumstances. So thank you for what your team is doing.
Thank you, Dr. Versio.